So good morning, sir. My name is Naimay Ali, and today I will be going to report or the summary report of our subject drug education and vice control. So first, let's first define the drugs. So drugs define chemical substance used as medicine or in making medicines which affects the body and mind and have potential for abuse. Without an advice or prescription from physician, drugs can be harmful. It is also called medicine. So drug is also defined as any chemical substance that by virtue of its chemical nature alters the structure and functioning of a living organism. So ang drugs bitaw is there are different types of drugs. So ang drugs kuno daw is a chemical substance nga pwede bitaw ma-abuse or but ang purpose gud sa drugs is for medicine but some people kay gina-abuse nila ang drugs bantog it becomes an illegal. So the two forms of drugs, the natural drugs and synthetic drugs. So natural drugs include natural plant leaves, flowering tops, resin, has his and opium and marijuana. So ang natural drugs is kanang bitang mga dahon-dahon nga natural bitaw siya nga motubo sa atong yuta nga without process. So next is the synthetic drugs are produced by clandestine laboratories which include those drugs that are controlled by law because they are used in medical practice. Physicians prescribe in our purchase and legitimate outlets like drug stores. So ang synthetic drugs is kanang bitong niagi siyang mga laboratories and experimentation and also needs ang prescription sa physicians in order to kanang bitong makuha bitaw na siya nga types of drugs. So kanitong mga drugs nga mga tambal or kanang mga drugs nga illegal bitaw. Next is ang administration of drugs or ang pagtake or unsaon paggamit bitaw sa types of drugs. So number one is the oral ingestion, the safest, most convenient and economical route whenever possible. The drug is taken by the mouth and must pass through the stomach before being absorbed into the bloodstream. So ang oral administration is kana bitong drugs nga ang pamaagi sa pag-absorb bitaw sa atong bloodstream or sa lawas is through oral kana bitong paagi sa atong mouth. While injection offers a faster response than the oral method delivers the drug directly into the body tissue and blood circulation. So giingon nga ang injection is kay mas paspas siya ma-absorb sa lawas kaysa sa oral because ipadiretso bitaw siya sa atong lawas through injection. Next is inhalation or make use of gaseous and volatile drugs which are inhaled and absorbed rapidly through the mucus of the respiratory tract. So we all know naman kung unsa ang kuno nga pang inhale or ang pasabutan na is kanang gitawng atong simhuton bitaw in order for us to absorb the drug. So ang the best example lang ni is kanang bitaw para sa bata bitaw, for example ginaubo, then na sila namo na bitaw machine nga ginabutan og liquid, then that liquid turns into gas that nga ikuan bitaw kanang simhuton sa bata. Ang tawag sa tambal is the sabutamol. One example sa kanang inhalation. Next would be the topical, the application of drug directly to the body site such as the skin. So kanang types of drugs is gina-apply lang siya sa skin, mura ginapahid bitaw. Dayon next is snorting, inhalation through the nose of drugs not in gaseous form. It is performed by inhaling a powder of so powder of liquid drug into the nose cause of the mucous membrane. So uso kay ni sa types of drugs no kanang ginasuyop bitaw nga kwan kay kwan kanang cocaine nga ginadiretso bitaw sa ilong the kanang suyop bitaw. Next would be the suppositories. The drug is administered through the vagina or rectum in suppository form, and the drug will also be absorbed by the bloodstream. So this type of drugs administration is ginapaagi siya sa genital parts of the women. Then Last is the mucous membrane inside mouth and the nose. So they are the toxicology, overdose and over extension of its effect. We all know naman unsay overdose kanang sobra nga paggamit bitaw. Or sobra nga kanang bitaw nilapas ang dose nga dapat i-intake nimo is imong gipalabuhan bitaw. Allergy cause release of histamine giving rise to allergic symptoms like dermatitis. Next is the idiosyncrasy, the sedates almen, and general. Number 4 is the general protoplasmic poison property of being general protoplasmic poisons. So the types of one is poison. Then side effect, which are unwanted. So ang kabalo naman taon sa side effect no kanang after taking the drugs kung usay mahitabo sa imong na side effect. Then tolerance, the body adjust to repeated use of certain drugs so that addicts soon find out that their customary dosage fails to give the expected effect. So ang tolerance is kanang bitaw maana di mong muscles or imong lawas bitaw nga permiga na take nga drugs. Next is the 7 categories of drugs: the herbal drugs, over-the-counter drugs, prescription drugs, unrecognized drugs, illicit drugs, tobacco, and alcohol. So, herbal drugs, these are plant substances that have drugs effect and whose use is not generally regulate law. So, kani nga herbal drugs, ipares ni siya sa kwan. Murag other meaning ni sa natural drug, which is the like the marijuana and other plant drugs. Next is the over-the-counter drugs. These are commercially produced drugs that may purchase legally without prescriptions, also known as proprietary drugs. So kaning over the counter drugs is kanitong nangapalit bitaw nato sa mga pharmacy or mercury nga di na kailangan sa prescription of kun bitaw doctors or the physician. Next is the prescription drugs. So kabaliktaran ni sa over the counter drugs because these are commercially produced drug that can be illegally sold or dispensed only by a physician's order. So kani is makuha nimo if there is a prescription coming from the physician or doctor. So unrecognized drugs, these are commerce product that have psychoactive drug effect but are not usually considered drugs. So these are substances are not generally regulated by law except insofar as standards of sanitation and purity are required. So ang example aning unrecognized drugs is kanang bitang ilim doon mga alcohol drugs and also sigarilyo kanang tabako mao nay mga unrecognized drugs bitaw. Then illicit drugs, these are drugs whose sale, purchase or use generally prohibited by law. Criminal penalties usually apply to violators of this law. So ang illicit drugs, ang mga example ni sa cocaine, opium, shabu, mao na mga big example of illicit drugs kanang bitang ginabawal sa atong balaod. The next is tobacco. This is not generally considered a drug and thus be class as an unrecognized drug. So mao na akong ganina sa example sa unrecognized drug ang tobacco. Next would be the alcohol. Could be included in the unrecognized drugs. So the alcohol also is included in the unrecognized drugs. So there are 4 pharmacological classification of drugs: the hallucinogens, stimulants, depressants, and narcotics. So hallucinogens are these are drugs capable of provoking sensation, thinking, self-awareness, and emotions, alteration of time and space perception, illusion, hallucination, delusion may be minimal or overwhelming depending on the dose. So ang hallucinogen is naga-hallucinate bitaw murag nagakuan kag mga illusion sa imong utok lang to murag paminaw nimo na kasalaing lugar bitaw mao na hallucinogens. The next is stimulants. These are drugs which increase alertness, reduce hunger, and provide a feeling of well-being. Medical uses include narcolepsy, overwhelming desire to sleep. The most common stimulants are cocaine and amphetamines. So ang stimulants kana bitang drugs ka kung intake bitaw nimo is mo gabi bitaw ang increase sa imong alertness bitaw, murag kanang di na kaganahan matulog bitaw. For the example na kaning cocaine and amphetamine or shabu, mo na the best example niya. Kabantay mo ng mga drug addict nga murag di na bitaw matulog, siga kay mata. Next is the three is the depressants or the downers, drug which suppress vital function, especially those of the brain or central nervous system, with the resulting impairment of judgment, hearing, speech and muscular coordination. So ang depressant is a type of drugs bitaw nga makaluya bitaw sa mga dili ra imong lawas, pati imong kana bitaw, pati imong mental health bitaw kay mapaluya niya. Nga feel nimo kay permi nakakapuyon, di kana bitaw di nakagana mo lihok. Then last is the narcotics. These are drugs which produce sensitivity, relieves pain, stupor, melancholy or dullness of mind with delusion. So ang narcotics is kanang type of drugs nga mga pain reliever bitaw, kanang mga all types of pain reliever, like kanang bitaw anesthesia sa hospital, mo na types of kanang na example sa narcotics. So last is the sample of dangerous drugs. So there are 15 types of samples of dangerous drugs. So kaning 15 is sample na siya na apay daghan. One is the opium, morphine, heroin, codeine, paregoric, demerol and methadone, barbiturates, seconal tranquilizer, volatile substances, alcohol, cocaine, caffeine, shabu, and last is the nicotine. So that's all for my report about the summary of our subject, sir. Thank you and good morning, and also God bless.